Good evening. I'm Dr. Esther Ellis, Territorial Epidemiologist for the U.S. Virgin Islands Department of Health, and thank you for joining us on the Press Box. This is a break from us talking to you and an opportunity for us to speak with you. We are here today to speak about the Food and Drug Administration's recent authorization for emergency use of the Pfizer-BioNTech COVID-19 vaccine for children ages 5 to 11. Joining me for that discussion is USVI Health Commissioner Justa Encarnacion, and she's joining us from St. Thomas. And with me here today is Dr. Anthony Ricketts, Managing Physician and owner of Pediatric Care Center right here on St. Croix. Welcome, and thank you all for joining us. Please post your questions in the comments section, and we will try to get to as many of them as we can. We're going to start tonight off with an update on the current number of COVID cases and also vaccinations within the territory. As of November 4th, 2021, there have been a total of 7,260 cases of COVID within the territory. 9 of those cases are within the last 24 hours, and all 9 on the island of St. Croix. There are currently 83 total active cases, 76 on St. Croix, 7 on St. Thomas, and 0 on St. John. 7,094 individuals that got COVID have recovered, and thus far there have unfortunately been 83 fatalities. In regards to the vaccination numbers, 49,149 individuals are fully vaccinated. That is 56% of our total population using our new 2020 census data. Now, let's move to questions from our guests, starting with Commissioner of Health, Justa Encarnacion. Commissioner, the VI Department of Health has been anticipating the FDA authorization for the use of the Pfizer vaccine for children 5 to 11. How has the Department of Health been preparing for this distribution and administration of the vaccine?
Well, first thing is really just listening to what CDC and the FDA had to say. We have been anticipating this from the time COVID vaccines became available to the United States Virgin Islands and to the nation. And I have 2 individuals, Dr. Esther Ellis, you yourself, and Dr. Tyhan Caesar, who calls me every other day, when are we going to be able to administer the vaccines to children? I mean, it's critical. So we have actually been speaking about it. We've been working on it. And we meet with the federal government at least 2 to 3 times a week. ASTO, the Association of State and Territorial Health Officials in particular, we have the director of CDC. They meet with us, not only she, but her staff, and they prepare us and they ask us questions. How do we think the vaccine should be distributed? One of the things that I think it came from the Commissioner of Health or the Secretary of Health in New York City. He is a pediatrician, Dr. Ricketts, and one of the things he said is that, how do we want to distribute it? We always have to make particular thought processes on, well, how do we care for children? Do we want the children to go to the CVCs, to the pharmacies? How do we have a more controlled environment to ensure that they're being cared for as children? And so those are the things that we took into consideration, we spoke about, and of course we are prepared because at the minute we are able to order them, we have them here within the territory, and we're ready to distribute.
Great, that's wonderful news. Very exciting that we have the vaccine here in the territory ready to give to our 5 to 11-year-olds. That's wonderful news. Many Virgin Islanders are still concerned about the safety and efficacy of the vaccine. We're still working towards community immunity. What are some of the main differences between the adult vaccine and the vaccine for 5 to 11-year-olds, an adult being 12 and up?
Well, the main difference is the dosage. Of course, it's going to be a small dose that the children are going to be getting. And that's one of the reasons the packaging of the vaccine took a little bit longer. Of course, they had to do a lot more studies. And so they studied not only what was going on and the effects of the adult vaccination, but how was that going to impact children? And so that was conducted as well. So the main difference is really the dosage of the vaccine that's being given.
Great, yeah, so like you said, it's just a third of the dose, all the ingredients are the same.
Same thing.
And what is some of the safety concerns that we're hearing from the public?
In reference to the children versus the adult vaccines?
Yes, in reference to children.
Well, you know that St. Croix, the Virgin Islands in particular, not just St. Croix, our vaccine rate for children have been always a little low. Last count, I think, was around 65%, and that is for childhood immunization vaccines, which is not good at all. And so the hesitancy may come from that in of itself. This is a pandemic, so it's a completely different conversation I think that we need to have. So the some of the insecurities would be the same thing that adults are feeling at this point in time. Were they enough studies done, not just on children, but on adults? So that's why it's important to realize that the way that they're doing the studies on vaccinations today, the level of and intricacy of monitoring and the instruments that are being used are so different. The technology that's there and the ability to run tests on a higher speed, all of those things need to be considered. In other words, they have done everything that they can possibly do to test a vaccine, not just on adults, but on children. As, of course, a smaller number of children were looked at during the study. However, they did not see any indication that those vaccines or the childhood vaccine should not be given. You always weigh the differences in the benefits and the costs of administering any type of medications. And you always hear that there may be some symptoms that you see when you give a medication, and vaccines are a medication, but what is the benefits of giving that? And right now, they did not see anything that gave an indication that children should not receive the COVID vaccine. At this point in time, children we have seen up to 7 months old, I think was the youngest that we saw with a positive COVID test. And we've seen over 100 being the oldest. So COVID-19 really and truly has no target. Anyone can receive or acquire the transmission of a COVID positive test. So really, it really gives us an opportunity to ensure that we have access to everyone, no matter what the age group is. So we're looking forward to actually seeing vaccines available for even younger than 5 if possible.
Exactly. I heard, maybe the 2 to 4-year-olds will have approval by Christmas, potentially, or early next year, and plans for that. But yeah, the clinical trials are one thing, but even looking at the data for children age 12 to 17, there's been over 12 million vaccinations given for 12 to 17-year-olds, and that's a full dose. So it's 3 times
Correct.
the dose that will be given to the 5 to 11-year-olds, and it has shown incredible safety and protection. There have been a handful of cases of what's called myocarditis, and that's basically an enlarged heart. But if you look at 12 million 11 to 17-year-olds that got COVID, there actually have been hundreds of cases of myocarditis. So getting the vaccine is much more safe than getting COVID. I would like to ask you, can the vaccine give you COVID?
No.
The common
And we've spoken about that several times in terms of the live virus, and the live virus it's not something that is being distributed during when the vaccine is given. And Dr. Ricketts could probably speak a little bit more about that and relay, because he sees the children and the parents on a daily basis, and relating to he can get children and parents to do things that a lot of us couldn't get them to do. And that's why it's important to have someone, a specialist, be able to allow and contribute to the conversation as well. So yes.
Exactly. Dr. Ricketts, would you want to expand on that a little bit?
Yes. So I think what the commissioner is referring to is the fact that in some vaccines, you actually give a part of the virus that stimulates the body to produce the antibodies. With these vaccines, you're not giving any part of a virus, but you're actually giving mRNA, which encourages or which stimulates the body to produce the antibodies. And eventually, the mRNA is removed from the body. So it's in terms of giving live or parts of a live or even a deactivated virus, it's really not that. So you cannot get the infection from the virus, from the vaccine itself. It just makes the body think that it has been infected and as such produce the antibodies. So the next time you have exposure to the real virus, your body is prepared.
Right. No, thank you for that. I do have to say.
Can I ask Dr. Ricketts a question, Dr. Ellis?
Yes, please.
If we compare the COVID vaccine, a lot of childhood vaccines are being given on a daily basis, right? So,
Right.
Dr. Ricketts, how do you compare the COVID vaccine to the vaccines that the children get on a regular basis?
Oh, that I think is a great question, because occasionally you have some conflation between what a vaccine is and an immunization is. So, your attitude towards the regular vaccines, which are on the childhood schedule, is kind of affected by your reaction or your attitude towards the COVID vaccine. And so, again, to the commissioner's point, the COVID vaccine is a completely safe vaccine, except for some of the reactions that you have mentioned. It does produce a very, very high response in terms of how it protects you against the COVID-19 virus. And so the only difference I would say is with the COVID vaccine, after you receive the vaccine, you do have a response,
Right.
but that response over time diminishes. With the regular childhood vaccines, once you receive the vaccine and the boosters that are recommended, then it's a lifetime coverage for you. There are
Right.
one or two vaccines in the childhood schedule that you need boosters probably every 10 years. For example, the tetanus shot. But with the COVID vaccine, having had two doses of the vaccine, I think right now they're recommending the booster shots be given after about 6 months. So there is some waning of the coverage or your protection after a period of time. So those are the main
Right.
differences.
And that's probably a little bit similar to the flu vaccine.
Exactly.
Because, it mutates very quickly. It infects, the more people virus infects, the more opportunity for it to mutate and change enough so that you need to modify the vaccine potentially or get a booster to provide protection again.
Exactly.
Right.
Exactly.
And even with and Dr. Ellis, even with the flu vaccine, they indicate that if you're 6 months and above, you can get the flu vaccine. So these are things that have been happening over time. The COVID vaccine may be a vaccine that's made because we have a pandemic. The COVID SARS-CoV-2 virus has been around for about 1.5 years, close to 2 years now, actually. And so it's something that we're doing, but we've been given vaccines for years and years. So this is not a new entity.
Right.
Exactly. Excellent point. So, Commissioner, I have to tell you, and in the beginning, you said that you've been speaking with Dr. Hunt and I a lot about, planning for this, and we anticipated the arrival. But I do have to say, when the vaccine came here just the other day, I was jumping up and down, so excited, because I have a child who's in that 5 to 11 age group, and I can't wait for them to get the vaccine. And I also was just so excited for our territory, because it provides us an opportunity to really increase our community immunity, because we have a whole new age group that's just qualified to get protected. And that age group covers all of our school-age children. And it's really going to make a huge impact on our ability to keep schools open safely. So I would like to ask you, is there anyone in the 5 to 11 age group that shouldn't get the vaccine?
We go back to the reasons why adults shouldn't get the vaccine, and that is, you have those that are severely immunocompromised. There are some conditions that Dr. Ricketts can speak to a little bit more about in reference to how a child if that child is for some reason severely immunocompromised and should not receive, or very high risk, then of course that child should not receive the vaccine. But that should be determined by a specialist, by a pediatrician, and not just by the parent. Allow your physician to be the determinant whether or not your child should not receive the vaccine. Going back to what Dr. Ellis says, the risk does not outweigh the benefits of receiving the COVID vaccine. So very limited amount of individuals should not receive the vaccine. Overall, we should all be party to receiving the vaccine. One of the things that I wanted to speak about, and you started to touch on it, Dr. Ellis, is, going back to school. I know we'll be talking about that in a little bit. However, it's not just going back to school. You know, I remember seeing videotapes and, you know, like commercials where some family members, they built it's a hug machine so that grandchildren can actually hug their parents or grandparents. And so this now is somewhat of a protective barrier. So when now these children can become vaccinated, their immunity increases, like you say, community immunity. So they now can actually be around more safely around their grandparents, their great grandparents, and be able to be in their environment a little bit more. We have lost so much over this year and a half, close to 2 years, because of COVID. Communicating through Skype, through videos, but that face-to-face interaction have been lost somewhat, even not just in school, but also outside. And I'm looking forward to that a little bit more.
Me too. This has all been valuable information. Thank you for watching with us tonight. We are going to go to a quick break, and when we return, we'll talk more about going back to school safely.
But what you saying, Jimmy? Me saying a hot minute, you know. We're going on today, it's been a hot minute for real. You want to know something? My mother told me that I can't come out my house for the COVID-19. I know we ain't safe out here for a little bit, but still I just have some fun though. Well, my side can't leave the house unless I'm vaccinated. But you won't scared of the vaccine? Nah, sis. The vaccine's safe.
VI people, you must stay at work. COVID-19 is not a joke. It's much more than good hygiene. Give your children the vaccine. Education is the golden rule. Children need in-person school. They miss music, dancing and sports. Vaccination is better, not worse.
I want a COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. I want to see my friends and family. Playing with them makes me happy. It's safe, mommy. The vaccine safe, safe, safe.
Children can become infected, get sick, and spread COVID-19 to others. Widespread vaccination is a critical tool to help stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. The MCH division encourages you to get your children ages 12 years and older vaccinated.
I want a COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe.
Brought to you by the Virgin Islands Department of Health MCH program.
Virgin Islands veterans, I'm standing here on Veterans Drive, built in honor of us, Virgin Islands veterans. But we now must do our part to bring more VA medical benefits to our shores. How can we do that, you may ask? Get on www.va.gov and get registered. This is the way that we can do our part. Get registered at www.va.gov. We're counting on you.
Good evening, and thank you for joining us again on the Press Box. Welcome back to all of our guests. I would like to circle back to the question that we just ended with before the commercial break and allow Dr. Ricketts a chance to speak with us too about who shouldn't get the vaccine from 5 to 11.
Okay, so we recommend that all children get the vaccine between 5 and 11, especially with the new approval that has come from the CDC and FDA for emergency use. Mm-hmm. There are some children from a medical standpoint that shouldn't get the vaccine, and those would really be the absolute contraindication to getting the vaccine would be, of course, if you were allergic to one of the components within the vial.
Right.
So generally, there are only two things that are somewhat that would cause allergies. And usually when we talk about allergies in the general sense, we might talk about a little itching or runny nose, but in terms of vaccines and the reason why you wouldn't give a vaccine due to allergy, we consider an allergy to be something a little more severe, like vomiting, your blood pressure is a little cold sweating, severe illness, that type of thing. So even if you have a slight reaction, we don't consider that an allergy. There's some contents within both vaccines, the J&J, the Moderna, and Pfizer, that have, it's an emulsifier, it's called PEG or polysorbitol. Some children are allergic to that.
Okay.
So if there's a known allergy to these components, then definitely you would have to let your pediatrician know.
And those components are in other vaccines.
They're in other
right?
vaccines
so
too.
If
yes.
a child has gotten other vaccines
Yes.
and not had that reaction,
Then you should be okay. The other thing to consider is if the child or if your child has had any allergy whatsoever to any vaccines, you really need to let your pediatrician know prior to getting the vaccine, or if your child has had any severe reactions or allergic reactions to anything.
Okay.
So it would be good for the observation to be made after the vaccine is given, and also for the pediatrician to kind of weigh the benefits of getting the vaccine against some of those adverse reactions that you might have. But the contraindications are very specific and few. You did mention one other thing, which is a child who's immunocompromised. You have some children who are on medication due to whatever medical condition they have, for example, cancer, or a condition called nephrotic syndrome where they're on steroids for a very long time. So cases like those need to be individualized, looking at what the risk is versus the benefit of getting the vaccine.
Thank you. And one of the reasons, all of the reasons you gave for who should and who shouldn't, is one of the reasons why only pediatricians or MCH will be giving out the vaccine for 5 to 11-year-olds. It won't be given out at the vaccine centers, and it won't be given out by the clinics that have been giving out the adult vaccine. It will be administered by our pediatric providers within the territory, as well as maternal and child health within the Department of Health. Anything to add to that before we move on to schools, Commissioner?
It's for clarifying and adding allergies as one of the things that we definitely need to look at. Just a clarification for where the vaccines or the pediatric vaccines will be given. And that goes towards looking at, we may be giving them at the CDCs, but if we give them at the CDCs, it will be given under the oversight of a pediatrician, as well as we will have individuals there who know how to care for that population. So no matter where it's given, the key is that there's a pediatrician, a nurse practitioner, and someone there who can care for those individuals, for the children when they get the vaccine. We're also speaking with the Department of Education. How can we get the vaccine to those individuals? But like I said, no matter where the vaccine is given, the appropriate provider will be on hand.
Exactly. Thank you for clarifying that. And obviously our 5 to 11 age group is considered a vulnerable population, and we are going to do everything to ensure that the safeguards are in place wherever the vaccine is administered. A provider is on site. We already have at our CVCs a provider on site, but we also have access to medications or medications you would use if there is an allergic reaction. So that'll be similar to where the vaccine is given for the pediatric population. But moving to schools perfectly, how has the Department of Health been working with education to safely keep schools open currently, and then also with the higher grades opening soon? How have we been working with education to make sure that happens safely?
Okay, well, first of all, we've been working with the Department of Education since the inception of the pandemic. And one of the things that we did do is we ensured that we had one person working with each department and large agencies like UVI, VI Water and Power. Those may not be full-fledged government entities, the hospitals, and of course, all of the departments. So education has a buddy in the Department of Health. Dr. Christensen actually used to be their buddy, and she was on the phone with them every single day practically. And right now we have another buddy that works directly with the Department of Education. So that's one of the ways that we've been preparing, just having those conversations. We've been prepping them. We've met with the Department of Education and CDC. Whenever a CDC or ASTO or HHS guideline comes out, then I make sure that I forward that information to the Commissioner of Education so she can have her team on those calls. Now, of course, the Department of Education nationally have their own slew of meetings so that everyone can be on the same page of how they actually distribute not just the vaccines, but how they keep everyone safe while going to school. So as you know, school have been open for certain age groups, and we have had some incidences, but education and training continues. So that, I think, is the most important part. Now, having the availability of the vaccines from 5 to 11-year-old gives us an advantage. We have had those individuals in school at this point in time, but they've been exposed to COVID. Teachers who have not been vaccinated, parents who have not been vaccinated, friends who haven't been vaccinated have been exposing those that have been in school, and of course some transmission has taken place. So it's re-education, retraining, continued education. Right now what we're going to do is continue to educate on the effectiveness and efficiencies of giving the 5 to 11 doses of the vaccine. So communication is one thing. They hold my hand, we hold their hands. We help each other. We collaborate with each other. That is the only way. And Dr. Ellis, you and your team as epidemiology, you link with education on an ongoing basis. I think they have you on speed dial, so as they do me. And so that connection is how we keep each other safe.
Exactly. And after you started talking, I remembered I actually had a call with them today. I speak to them so often. It's daily isn't surprising, but we are always working together and planning. The Department of Education school nurses have all been trained in how to run the Binax antigen test, which is the rapid test. And if any child is at school sick, they have the ability to actually test that child on campus prior to that child going home, because if they're sick, they're going to be sent home regardless, and know if that child's actually positive for COVID or not. Because if it's positive, then we have to contact trace quickly within the school. They also use our online beacon system, which I know a lot of you listening have probably used that system for scheduling your vaccines, scheduling a test at the Department of Health, and they use it to put the data in to the database for every single person that's been tested. So it's a wonderful collaboration. I look forward to less COVID in the schools once more children have had the opportunity to be vaccinated, but the majority of our cases also are 30 and under. So most of our new positive cases have been under the age of 30. And so you're not safe if you're a young person. You think, oh, I'm young, I'll be able to get COVID and recover quickly. But you're actually very much at risk if you're a part of the unvaccinated population. We are going to go to another, oh, go ahead, Commissioner, sorry.
Real quickly, I want to leave by saying that, yes, the ones 30 and under are not getting vaccinated, and they may think that they're not as vulnerable as the others, but remember, when you under 30 do not get vaccinated and contract COVID, you're doing okay, but the individuals who are around you that are over 30 and may not be as how would you say, indispensable as you think you are, they might be the ones who get sick and die. So please be careful and always think that way.
Right. We're going to go to a quick break, and when we come back, we'll be speaking more about the FDA vaccine for 5 to 11-year-olds. Thank you.
Okay, great. Thank you.
Hey, you.
Hey, babe. Thanks for lunch.
You're welcome. Who was that?
That was a representative from the Virgin Islands Department of Health. They're doing a survey called BRFSS.
Oh, for what?
It's to address chronic diseases facing the Virgin Islands: diabetes, heart and kidney disease, cancer, stroke, and more.
What kind of questions do they ask?
They ask questions about food, exercise, age, smoking, and some others.
Is that all they ask? Do they ask questions about...
Security? No. They don't ask anything about Social Security, money, or credit card information. The information that they do collect is used to guide public health programs that affect all of us. You, me, the kids, the community, and the entire Virgin Islands.
Oh, okay. Very interesting. I'm glad we could do our part to help.
Yes, we've got to do our part.
For more information, visit our website or call John Orr at 340-643-5422.
Has the COVID pandemic caused you to fall behind on your rent? What about your electric or water bills? Well, VIHFA's Emergency Rental Assistance Program is here to help you catch up. For program details and qualifications, go to VIHFA and click on the ERAP link. From there, it's just 3 steps. 1. Make sure you are eligible. Have you lost income due to COVID-19, owe at least 1 month of rent or utilities, and meet the federal household income guidelines for your island? 2. Gather all the required ID and documentation for all members of your household, plus statements from your landlord or utility company. 3. Submit your application online at vihfa.gov or call one of the intake centers on your island to make an appointment to apply in person. For more details and locations of the intake centers, please visit vihfa.gov.
When you're deaf or hard of hearing, operating a vehicle presents a unique set of challenges. If you're pulled over by the police, please follow these directions. Using your left hand, hold your communication accommodation visor card outside the driver's window in plain sight for the officer to see. Indicate to the officer the best way to communicate with you. The officer will then use this method to alert you for the reason of your traffic stop and what you need to provide. Be sure to follow all the officer's instructions to ensure a safe and calm interaction. To obtain a communication accommodation visor card for drivers who are deaf or hard of hearing, please contact the Virgin Islands Bureau of Motor Vehicles at 774-4268 on St. Thomas, 713-4268 on St. Croix, or 776-6262 on St. John.
Sponsored by the Disability Rights Center of the Virgin Islands.
Good night. Thank you for joining us on the Press Box. We are very lucky tonight to have a special guest, Dr. Anthony Ricketts. And I would like you, Dr. Ricketts, to tell us a little bit about who you are. What is it like practicing on St. Croix? Tell us a little bit about what you do.
Right. So obviously, I'm a pediatrician. I work at the Pediatric Care Center here in St. Croix. Mm-hmm. We've been here for roughly about 22 years. Continuously, and we've never faced a challenge like we've faced in the past 2 years with the COVID-19 epidemic. So I really applaud yourself and the commissioner for the amount of effort and time that has been put into dealing with the epidemic, both in the adults, but then also with the children. Yeah. Our focus so far has been in prevention. That is with the adults having the vaccines and then doing everything possible, hand washing, masking up, and distancing, and also following the policies with the CDC in terms of preventing the children from getting ill. With the advent of this vaccine and the EUA right now, we're a little more, we can be a little more proactive in preventing the kids from this deadly disease. Now, the big issue in pediatrics is prevention. And so being able to afford them the opportunity to get vaccinated at this particular point in the pandemic definitely gives us another tool that we can utilize in preventing disease. So most of the focus of our practice over the years has been education, prevention, well visits, including vaccinations, and then now we have the opportunity to add the COVID-19 vaccine to it.
Okay, that's, excellent information. What has the communication been in the pediatric community?
Yeah, overall, in a general sense, we definitely have had concerns about our vaccination rates, as the commissioner has alluded to. Mm-hmm. And because of the concerns about vaccines in general, and then the compounding of that concern with the COVID-19 vaccine, we have seen a slight shift in the attitude towards the regular vaccination, immunization schedules. And so we're getting a few more people pushing back against the general vaccines. So the concern in the pediatric community has kind of ranged a lot in terms of what is the acceptance of the vaccines on the children's side. But I think one of the hidden problems that we're facing in the pediatric community is the increase in mental health issues, behavioral issues that are as a result of this drastic change in daily activity or their daily lives. And so we're seeing a lot of behavioral issues coming to the fore, coming to bear. We also are seeing, believe it or not, a lot of obesity. A lot of the kids are home eating. And then we also have a lot of the kids, turning to social media because, of course, they're doing the online schooling, the virtual classroom. And so that is a segue into getting into social media. So there's some very unintended consequences in children staying home. So it's one thing to say, I'm going to keep my child home because of the COVID, but there's a very subtle underlying long-term effect in mental health and behavior of your children too.
The side effects of COVID that go so far beyond the actual COVID. Commissioner Encarnacion, actually one of the first times I met you was in the pediatric community, and I know that's always been near and dear to your heart. What is your take on what is happening in the pediatric community as it relates to COVID?
I have to laugh because I had my vision for speaking about COVID and the pediatric population, and Dr. Ricketts hit it right on the head, and that is the behavioral aspect of what's going on right now for children in the COVID environment. And I don't think that we think that hard about the emotional effects of staying home, of not being able to be as active as children normally are at school, and seeing those effects on children. And so we have individuals within the community who work directly with children. Right now, we have the Project Launch program within the Department of Health. It's ran through MCH, and we will be bringing that back to the community to have that discussion with you. What is Department of Health? How are we working with Department of Education, Department of Human Services, and working on the effects or the emotional and behavioral effects, as Dr. Rickett indicated, with COVID-19. So that's one of the things I think is really on top of all of our minds. How do we combat that? And that's one of the reasons why Governor Bryan, Lieutenant Governor Roach, and his staff is so interested and so, engaged in having students go back to school in January. And this is a good time to do it. We have the vaccines available. One of the things that no one can say is that we did not prevent access. We have ensured access to vaccination, access to care in terms of monoclonal antibodies, and there are other antiviral that are going to be coming to the territory in short time that we know we will have access to. So there is no reason. Once someone said to me a couple of weeks ago, we are in a pandemic by choice. So it's not because we do not have access to the resources that we need, but we have chosen not to accept those resources. And going back to children, as an adult, we make decisions for ourselves, but we also have to think about the decisions that we make for ourselves and how it impacts the ones that are around us, the little ones that are around us. Looking at what Dr. Ricketts is saying, it now has an effect on childhood vaccinations in general. What do we do here, and how do we change that in the future? How do we go back to ensuring that everything is the vaccines are safe? We do not want to revert back in history where we see communicable diseases emerging more and more because we have stopped receiving the vaccines that have been working for so many years.
Right. I mean, we all want to get back to normal, but in order to do that, we need to reach a certain level of community immunity that protects the most vulnerable, the 25% that can't get vaccinated. So we do,
If I may also add, and Dr. Ricketts spoke about it, and public health is all about prevention. looking at the social determinants of health. Why is it that, how do we get sick? Why, especially chronic diseases, are they items that we do on a daily basis that can prevent chronic disease from occurring? Look at what Dr. Ricketts said. If we look at prevention being a cure, looking at the fact that we have access to the vaccine, we have access to vaccine now from 5 to 11, from 5 and adult to adulthood. That's all the preventive measures that we can actually offer right now. And you also add your hand hygiene, your social distancing, your mask wearing, all of those things. But the cure for the pandemic is the vaccine.
Exactly. Dr. Ricketts, what questions do you get most from parents of young children about the COVID-19 vaccine?
Well, I think yourself and the commissioner have alluded to the question about what are the contents of the vaccine and if they are safe. For the most part, the major concern about the contents of the vaccines are related to some of the inactive ingredients. And a lot of those ingredients are put into the vial to enable the vaccine be stored properly and also be transported. And they're very, very minute amounts. So the big concern in some of the older vaccines that we used for the immunization schedule was mercury. There's no mercury in that. The PEG and the polysorbitol, those two contents are in minute amounts, and they do not have any effect except you could be allergic to them. There has been the theoretical concern about infertility in adults, and we do sometimes get questions about future infertility. One of the things that you're unable to do is look into the future. If you've been using the vaccine for a year or two, we could not conclusively say that to you. But from the studies so far, with the people who received the vaccine in the clinical trials, there has been no effect on their fertility. One of the other questions are long-term effects, like with the virus itself. There are some people who get sick, and technically they never get well, or it takes them a very long time to completely overcome the symptoms. So they lose their sense of taste, their sense of smell. Probably they get a little weak when they exert themselves.
Right, long haul.
Right, and the long haulers, exactly, the long haulers, they get better, that is, they get out of the hospital, but the symptoms linger for a very long time.
Right.
So there's some concern that, you might become a long hauler. But to your point, you're not giving the actual vaccine, the actual virus itself. You're just giving something that would make the body produce the antibodies.
Exactly.
Right.
Yeah, and with long haulers, it's very common now that we're finding down the road that people who have recovered from COVID, they got COVID, they weren't vaccinated, they got sick with COVID. They're having these long-term symptoms, whereas individuals who got vaccinated late last year, we're almost a year in now, are not having any long-term symptoms from the vaccine. And vaccines aren't new. Vaccines have been around for a very, very long time, since before I was born, and many generations, and have saved millions, billions of lives.
I would just add, I've heard some people say they would just, why don't they just get the illness, the infection? Because they understand that you will get some protection after the infection. And I think that is a very dangerous way to get protection, because not everyone responds to a COVID-19 infection the same way. Exactly. It's very difficult to project exactly what would happen when you have this infection. With the vaccine, you're much, much, much safer in getting your protection with the vaccine rather than getting the infection.
Right, that's an excellent point. One of the most common questions I get is it safe? And the short answer is yes. It is safe, and it's one of the most studied and tested vaccines that we have now based on how many individuals have gotten this particular vaccine compared to other vaccines throughout history. I consider it safe enough that I'm going to give it to my own child as soon as possible. I'll be in line jumping up and down excited for the opportunity for my child to have protection. What are some of the common questions that you get, Commissioner Encarnacion?
Well, I think safety is definitely one of them, but I think both you and Dr. Ricketts have exhausted that topic. Honestly, one of the questions that I get is why, or why should I? And I think that's one of the things one of the questions I'm sure both of you get as well, not just because it's safe, or are you infringing on my rights? We hear that a lot. And you can turn that around and look at the rights of the individual. And I'm going to give you one thought. Everyone used to smoke, not me, but a lot of people smoked, go into restaurants and you would smoke there. And then of course, secondhand smoke was a conversation. And the Surgeon General said to us that secondhand smoke is determined to be even worse for you than your direct smoker. So everyone said no one else would be able to go into certain restaurants or bars or hotels, hospitals, unless you're like 50 feet apart from there. So you were not allowed to do that. Why? Because you were infringing on others' rights. It's basically the same thing with the COVID vaccine. If you are not immunized, we don't want to infringe on it's your choice whether you get vaccinated or not. We encourage you because your choice affects us if you do not get vaccinated. But in essence, you infringe on other people's rights. Those who, for some reason, whether it be severe immunocompromised situations or severe allergies that cannot get the vaccination, in essence, you infringe on their rights because they cannot be vaccinated, whereas you may be able to be, and you might be able to help them save their lives.
Yes. We are going to go to a quick break, and when we get back, we're going to take questions from our audience.
I have asthma.
But all asthma triggers aren't the same for everyone.
My triggers are dust, mold, and pollen.
Strenuous exercise.
Perfume and tobacco smoke.
Anxiety and stress.
To manage my asthma, I needed a plan.
I worked with a neurologist to identify my asthma triggers and found the best medications to prevent and control my symptoms.
As I got older, my asthma changed, so I talked to my doctor about adjusting my plan.
Partnering with my family and healthcare provider helps me manage my asthma and keep doing the things that I love. And now I can breathe much easier.
To learn more about managing asthma, visit doh.vi.gov.
Welcome back to the Press Box. We are very lucky tonight to have our very own Commissioner Justa Encarnacion joining us from St. Thomas, and Dr. Anthony Ricketts joining us from Pediatric Care Center. We are going to spend the last time that we have on the Press Box talking about some frequently asked questions, some questions we've received from the audience, and some questions that we get commonly from the community. So the first question, and if you've been vaccinated, this might seem like an odd question, but how is the vaccine administered? Is it oral, a pill, or an injection? So Dr. Ricketts?
Well, the vaccine is given as an injection into your muscle, usually into the arm. The person who asked that question might have seen reference to a pill that has recently, I think as recent as this week in the United Kingdom, been approved for use, an antiviral that has been approved for use. But here in the United States, we do not have that. So it's all given by intramuscular injection.
Okay, great. A question that we have from our Facebook listeners. We have Yamina Frazier. She asked, and this one's for you, Commissioner Encarnacion, where are the vaccines distributed through? private pediatricians, the Department of Health.
Hi, Yamina. We all know she's actually also a pediatric focused person. So Yamina, thanks for that question. It'll be given at our MCH divisions of the Department of Health. We're also, I just spoke with Dr. Hunt today to call Dr. Ricketts and see what we can do to work with him in distributing it in his pediatric office as well. We may be delivering it or administering in the CDCs. However, like I said before, no matter where it's distributed, we want to make sure that we have the correct private providers or public providers, pediatricians, paramedics who know PALS or Pediatric Advanced Life Support Systems. So we will be ready to make sure that everything that we do is safe. Thank you, Yamina.
Excellent. Dr. Ricketts, what should I do if my child has side effects?
Okay, so usually the side effects from the vaccine itself, could classify them as the local side effects. So for example, the site, you might have some pain, you might have swelling in the area. So just like you would do with any other vaccine, some Tylenol, rest. A big side effect is being extremely tired, being very, very tired the day after you get the vaccine. So most of the side effects, you have the immediate ones which are related to the area where the vaccine is given, and then you might have some what we call systemic symptoms, like your whole body. So you might have some muscle aches, you might have a headache, you might be very tired. But usually these go away within 2 days. Yeah. So if there's a fever, some Tylenol, if you're tired, you rest, and some observation. And I think this relates back to the commissioner's statement that it will be given under the supervision of a pediatrician or a pediatric professional, such that in the event there are any side effects, you can directly deal with. We would be aware of them and be able to advise accordingly.
Right, and most of the severe side effects, like a severe allergic reaction, would be immediately after injection. And so there is a requirement that you have to stay at the provider's location for 15 minutes after you receive the injection, just to ensure that you won't have any severe allergic reaction. That could be handled right there in the office. Otherwise, obviously, if you are home ever and feeling short of breath or like an emergency is happening, call 911. And we have wonderful hospitals, Von F. Louis Hospital on St. Croix and Schneider Regional Medical Center, on St. Thomas, Myra Keating, on St. John, that can deal with any urgent issues if you are having those from any medical condition at home. Commissioner, can a child receive the COVID vaccine at the same time as other vaccines?
Actually, I'm going to shift that conversation. I know they can, but I'm going to shift that question over to Dr. Ricketts, who administer vaccines all the time to his children. So, Dr. Ricketts, can you mind taking that question for me?
So yes, and I think this is a great question. And it comes up all the time. Right. And so very specific guidance has been given by the CDC and also by the FDA with regards to the COVID vaccine and when it can be given in relation to the other vaccines. The COVID vaccine could be given at the same time as other vaccines. It could be given the next day, it could be given the next week, it could be given a month after. So there's no correlation or no contraindication for the vaccine to be given in relation to any other vaccine.
Great. Yeah, good information. Another question, and I think this one might be for you, Commissioner. What have been some of the challenges with logistics, rolling out the vaccines, the different age groups, maybe a little bit on the boosters, third shot? What are some challenges and how can we simplify this process for everyone? Because it's confusing for us.
Yeah, so I think that what we have done is we've waited for the decision making to occur with FDA and the CDC And then we, in turn, make sure that we make the decision based on us as Virgin Islanders. And I think that has actually worked very well, because we have to admit CDC has changed its mind ever so often. And because of that, we have concerns. So rather than rolling out things right away, we've actually taken the position to wait, solidify our thought process, exactly what we're going to do. But just to let you know of course, with the Pfizer vaccine, it's you have your first and you have your second dose 21 days after that. With Moderna, first and 28 days after that, you get your second dose. And of course, your third dose you can get, with your Pfizer vaccine. And that's really just to give you somewhat of an increase and an advantage. Some individuals who are immunocompromised, for the reason that we spoke about before, may not have been able to get to that immunity level as the ones of us who are not immunocompromised. And so that third dose allows us to be able to reach to the same level as other people have. That's the third dose. Now the booster, which can be given after, let's say, 6 to 8 months of receiving your second dose or your first dose of your Johnson & Johnson, that booster allows you to increase your immunity, because sometimes your immunity wanes over time. And because of that reason, and because the pandemic is such a serious issue throughout the world, then that booster allows that. So I think, like you said, is the understanding of it. The big difference right now is the dosage, and not just for the pediatric doses, but the booster for the Moderna is also a smaller dose than that of the regular dose. So really, it's just keeping up with the dosages, the time frames. But right now, I think all of it is coming together. For example, with the booster, CDC, just to let everyone know, if you got, no matter what vaccine you got for your initial first, second shots, or your initial Johnson & Johnson, you can actually receive any of the vaccines as your booster. So things are changing. They continue to change. It's for us as healthcare providers to be able to take the information, let it settle, and then we try to give that information to the general public and make it easier.
Yes, that definitely clarifies. And as time goes on, it will get simpler, is what I'm seeing as well. Boosters for all. Mm-hmm. But we are out of time, and I want to encourage everyone we're going to have some closing comments from everyone. Right now, we have an opportunity to have some great guests tonight, so we're going to move to Dr. Ricketts for closing comments.
Okay, well, it'll be very difficult to close on this because, of course, the pandemic is still here. But, I really would encourage parents, those who are enthusiastic about the vaccine and those who have concerns, to, speak to your healthcare professional, get the information from people who deal with medical issues for children, as a profession or on a daily basis. And try not to get your information from non-medical sources. And I think once you get all the information and you make an educated decision, I think you feel much better about yourself. So approach your pediatrician or your healthcare professional that takes care of your child and, ask the right questions, come in with a list and, get some of your concerns addressed.
Great advice. Thank you. Commissioner Encarnacion?
Let me first thank you for facilitating and hosting the show, Dr. Ellis. And of course, I want to thank you, Dr. Ricketts, for responding the minute we called you, the minute I called. And you have done a wonderful job. It's been a pleasure to being on the show with you. And I really want to tell the general public, please go out and get vaccinated, but continue doing the other things that you can do as well. Wash your hands, social distance, and of course, wear your mask. And before I put it back over to Dr. Ellis, today is my son's birthday, and I would be remiss if I didn't say happy birthday, Robert Thompson. Love you. Thank you, Dr. Ellis.
Thank you. Happy birthday, Bobby. Thank you, Commissioner Encarnacion, for your leadership throughout this pandemic. It has been an honor to serve under you, and as you spearhead this, and the energy and the love that you have for everyone as you do it because you care. Thank you, Dr. Ricketts, for being on the show tonight. It was really great to see you again. And thank you to the audience for listening. Please get vaccinated. That's what we're here for. If you're just joining, go back to the beginning, listen to the beginning. But have a good night. Thank you.